am Dr. Karli Provost Goldstein. I'm a minimally invasive gynecologic surgeon, and I specialize in endometriosis and advanced pelvic cases. I started a practice 2 years ago focused on a whole body approach for endometriosis and incorporating a lot of different wellness modalities as well as expert care involved in endometriosis and doing a lot of the legwork for patients. That way, it's easier for them to have access to all of these different modalities. And so we have started a very exciting webinar series for the year called the Endo Exchange, and we will be focusing on a different topic every month and bring on a patient advocate with their own story and different experts about certain topics. And we'll be having sort of a roundtable discussion about all different things that could be important for an endometriosis patient in their lifespan. And so today I'm very excited to introduce a phenomenal team that works with me all the time and part of our ESSE Care team. And we have fabulous nutritionist Lisiewski, who had stage 4 endometriosis and a bowel resection and has her own personal experience healing and recovering through all of that. And she is a phenomenal nutritionist and a great resource to patients. We have Arleigh, who is a patient advocate and liaison and has had many years' experience with endometriosis herself, and has spearheaded a lot of opportunities with Connecticut, with the government, and very exciting advocacy projects. And she'll be talking a little bit about that in her story. And we have Lexi Burtman, a fantastic pelvic floor therapist at Solstice Physical Therapy, who we send patients to all the time. And she works with them preoperatively, postoperatively, or even if they haven't had surgery, to help with a range of different pelvic floor issues that can happen and come up, and give them strategies to help manage things on their own at home as well. And so it's very exciting and an honor for me to be a part of this today and to have everyone on board. Thank you all for coming.
Excited to be here.
Yeah, thank you.
And so what I wanted to talk about briefly first before I bring Arleigh on is that what we do that's a little bit different here at ESSE Care is go through, in a very long new patient visit, is go through sort of your entire life story and different factors that could affect how you're feeling, with all different aspects of your health, with mental health, with physical health, with your pelvis, with your bowels, with your nutrition, and with your medications, with different supplements that you're doing, all the strategies you've employed in the past and what you'd be open to in the future. We do an exam, and we do an ultrasound, and then we talk about and review any kind of imaging and operative reports and things like that that you have. And then we go through all of these different modalities in experts that we could give access to and help you with to come up with the best plan for wellness, and really combining all of these things to help reduce inflammation and support healing and support pain relief. Endometriosis is a condition that causes abnormal tissue to grow outside of the uterus, in pelvis, in extra pelvic locations, all over throughout the body. And it's systemically very closely tied with inflammation. It can cause a lot of scar tissue. And that inflammatory response, I like to tell patients, your body actually recruits inflammatory cells to come and hone in on the pelvis or wherever these disease locations are. Even when we get rid of endometriosis, there still can be some systemic inflammation. And we want to have strategies throughout life to help deal with all of these symptoms that may arise. And so all of these collaborative efforts will be important even when endo is gone. It is what can help keep you healthy and have, feeling really well and supported throughout your life. And so it's very exciting to combine all of these and offer this as part of the support system for patients. So Arleigh, why don't you take it off and tell us a little bit about your story, and then we'll have our experts weigh in on their approach.
Sure. Well, thanks for having me today. Super excited to be here. I am a patient advocate and certified health coach. I had a very long journey to diagnosis. even though my symptoms began at a pretty young age. My pelvic pain started at age 9. I didn't get a period till I was 13, but I dealt with chronic bladder, urinary issues, and constipation. And then when I did get my period, it was really aggressive right from the beginning. I had the normal sort of birth control given to me by the time I was at 15. And that was really difficult. There wasn't a lot of, I guess, information provided on what the birth control was going to do to my body. And for me, it didn't really help with my symptoms. If anything, it sort of exacerbated some mental health issues. And that went on for several years. I think I tried every birth control on the market at that time through high school and into my 20s. And then the misdiagnosis started, I would say like late teens, early 20s, blood work done for Lyme, mono, you name it, across the board, everything was normal. I started going for different ultrasounds, different tests, all sorts of different exams. I saw more than a dozen different gynecologists here in Connecticut, including some chief oncologists, gynecologists that weren't educated in the world of endometriosis. I had a hysterectomy at 34. And after that hysterectomy, a lot of things actually got worse. A lot of people think if they have a hysterectomy that then, well, it's going to be great. They're not going to have a period and they'll be fine. For me, my inflammation went crazy because I did not have excision surgery. I had ablation, and the inflammation in my body just was off the charts. And I ended up with frozen pelvis. And 24 years after I had the diagnosis of frozen pelvis, and that's when I met you, Dr. Goldstein. And then that surgery was a really big surgery with a bowel resection and a diagnosis of stage 4 deep infiltrating endo. And since then, I did end up having a couple other surgeries because of fibrosis and retroperitoneal fibrosis and some really nasty looking ovary. So I went into surgical menopause pretty young. It was like partial menopause because I did have one ovary taken during one surgery, and then the other one the second time, the fifth surgery, I had the second ovary taken. But it's become very clear to me at this point in my journey how important it is to sort of take care of yourself as a whole and not just sort of put band-aids on different things that are happening in your life. I'm super excited to talk about pelvic floor therapy today because that was such a game changer to my life. I learned so much about things that no one ever taught me. I learned how much is connected in the pelvic floor and how, your pain can really radiate to different areas from your pelvic floor. Like I said, I'm a health coach. I actually went back to school to become certified as a health coach because I wanted to learn more about how to heal my body and how to sort of control my inflammation through lifestyle and diet. And hormone replacement therapy is where I'm at right now. And it's been a little bit of a bumpy ride in the beginning to sort of figure out like where my levels were at. It's not one size fits all. So you shouldn't get frustrated if you have a really good doctor like Dr. G. She's gonna work with you, and you just have to be honest about your symptoms and just know that like it can get better. It's just sometimes it takes a little bit to figure out what works best for you. So there's definitely lots of options out there. And there's definitely ways to sort of take control of your life and not let endo control you. You know, self-care is super important. I find little things that I do, like my favorite kind of tea, or a favorite like face wash, or body lotion, like those little things. I find like I've become ritual with, and that sort of helps my day when sometimes you don't know how your day's going to go, because even though I've had multiple surgeries, I still struggle with nerve damage and pain because it took so long to get that diagnosis and have the proper surgery. So people need to remember that it's not something that like you can just eliminate and then your life is fine. And it's a long time of learning and self sort of acceptance, and self-care to really tackle endometriosis from all angles.
Thank you. Lisa, why don't you pop in and weigh in a little bit on Arleigh's story and bowel endometriosis and give us some tips.
Tidbits on nutrition and bowel. Well, like you had already introduced me, I am an endo survivor. Clearly, I feel horrible for any person who has to experience this disease, because it definitely takes a toll, just like Arleigh had explained. It really encompasses your life. But from even saying that, I feel at this stage, like I feel like I'm at the end of my journey with endo. I feel like I've conquered it. It's done. It's behind me. And if there's anything that I can say to anyone right now as an endo patient, there is hope. If you have the right care team, if you have the right surgeon, the right nutrition, the right physical therapist, that support system makes the most it's the most important. Like Arleigh had just touched upon, the hormonal therapy. If I knew what I know today versus what I knew, like just what I had to go through in my 20s, my 30s, my 40s, what would I say to the endo patient is that the information and even the resources that we have now are just so, I feel like it's just, we're at like the forefront of really trying to I don't want to say fix this disease, but at least manage it to a point where you can have a good quality of life. So one of the things that I do, I've been a practicing dietitian, functional nutritionist for the last 25 years. And one of the first things that I do when I sit down with any patient, whether it's an endo or an autoimmune type patient, I always like to sit and just get a background of what they're currently doing. Because most people that are in pain, they have gone down these rabbit holes where they're willing to do just absolutely anything. And I like to at least get a baseline of what they're currently doing, do a thorough examination, go through their medical history, their family history, look at the medications that they're currently taking, do a real thorough deep dive of the types of supplements that they're all consuming, go through their diet history, what kind of diet, what types of foods that they're consuming, look at their weight profiles, their body compositions, look at each system, their GI, how they're sleeping, what is their mental headspace at this point, what are they doing for exercise, and really just try to get a good look at just that overall picture, the labs, what kinds of, like, are they being monitored appropriately? The majority of patients are not even really getting good, thorough labs, whether it's nutritional parameters that we're looking at, and that breakdown of, the vitamins that they could be deficient in, as well as just doing basics, even some of the cancer parameters or the inflammatory markers, and really doing deep dives on the inflammatory markers. I think that's critical. And I really try to focus, I think, first and foremost, looking at their GI health. And we talk a little bit about, too, even doing some of like the food sensitivity testing, and looking at all of those and how that weighs in to the full picture. I think that's really critical.
And do you think there's a one size fits all endometriosis diet? It's always the burning question.
It really isn't. But what I do notice, like, what's going to work for one person, and I really try, and I think one of the best things that has happened over the last few years post-COVID, as a dietitian, I'm able to work one-on-one with patients and have insurance cover them. So I can see patients on a weekly basis, have their insurance cover their sessions, and really get down to how we can put them on a path that's going to change how they function on the day-to-day. And that's critical. Getting to know that patient, getting to know what's affecting their life, right down to how are you, like, what's going to work for you on a day-to-day basis for not only like your food, what types of foods are you eating? Are you eating the right brands? Are you taking the most optimal supplements that are going to make sure that translates into really good lab parameters, so that, omegas, for example, like I look at so many patients that aren't, it sounds like they're doing the right things. Like they might be on the right path. Yeah, you need to take a probiotic, or you need to look at some of, the superfruits and greens, but are you taking the right ones? And trying to put that whole picture together based on your medical diagnosis, it definitely is an art.
And I see a lot of, sorry to jump back in, but I see a lot of medication side effects often that patients are not made aware of. And they're on polypharmacy therapy for anti-anxiety, antidepressants, Zofran for nausea, and no one tells them that all three of those cause constipation. And so they have a functional constipation. Then they're told by a GI doctor they have chronic constipation and slow motility. Then they're given Linzess. And here we are, like another medication, and we have just medications on top of medications, all canceling each other out and causing really probably a very angry gut system, and their bowels to be going nuts. And I see patients that are given bowel medications and they're telling them to take it in the daytime, or they're not telling them what time of day. And they're taking Miralax in the morning and their bowels are cramping all day when they're supposed to be resting. And we need to offer these support vitamins at nighttime when digestion is actually happening. So we're not walking around all day fighting our own system. I think that's really.
But you make a huge point. I mean, I can't tell you how many patients I will see that are on so many different medications that are depleting their nutritional stores. And even one of the common themes that I see too is, you talk about mental health. If you're not absorbing appropriately and the gut is not functioning right, your basic metabolic function is not going to happen. And that is going to affect your mood. That is going to affect how you think, how you feel. And it's not going to translate into a healthy lifestyle. So really trying to, and I always focus, like with every single patient that I do, gut is probably the first and foremost that I really try to look at, and then kind of tailoring the diet in with the appropriate supplements and making sure that they're on the right supplements and making sure that they're on clean supplements, because there's so many things that are out there. I can't tell you how many patients I see on a regular basis that are, I get it. You get sucked into the whole, Instagram, or YouTube, gamut. And you really need to kind of discern what's good and what's not good. Like I tend to really focus on, and I've always kind of surrounded myself with a lot of the high-end functional doctors that are in my realm and in my space, and I look at more of the science-based protocols. And for endometriosis, there's, working on those, like I said, those pain pathways that will help kind of alleviate that level of inflammation that's seen within the endo patient. It's very critical. But you can't do that in just one session. It takes time, and you need to develop a good rapport and get to learn all of the things that are affecting a patient's life. And I will utilize, and now I won't just focus just on food. I'm focusing on things that I know are going to help the cells, all of our gut functions, so that you have optimal metabolism, and that level, and clearing that level of inflammation, or reducing it to a point where, like I said, you can actually have a better quality of life, so that on your day to day, you feel good. I can confidently say to you that not only as a practitioner, but as a patient, this is probably the best that I've felt in, I would say, out of all the decades of my life. And like I said, I'm at the end stage of endo. I feel like endo is definitely behind me. My hormones are regulated appropriately, and my nutrition is completely on par. My supplement regimen is great. How we monitor those patients and making sure that, their levels, their labs, their symptoms are in check, I think it's definitely a part of that whole body care that Dr. Goldstein and everyone here today is really kind of pushing towards.
And I think that's the exciting part, right? This is an ongoing journey and conversation, and I really feel the same way. I feel like 40s and post hysterectomy and ovaries out and menopause and hormone replacement, having steady state hormones and then the right tools. I mean, I tried to tell someone the other day, I was like, I feel better now than I did in my
20s.
Teens weren't good either. 20s, they were terrible. 30s, that was terrible. So I'm like, I don't know, since I was 8 or 9, maybe. It's like hard to imagine, but it's very exciting. Someone's asking about SIBO and endo, nutritional support for SIBO and endo. If you can weigh in about SIBO before we move on to some pelvic floor.
Sure. I definitely see a lot of patients that have gut dysregulation. And you really have to look at what patients are eating. So I'll sit with them. I'll have them do diet recalls. I'll have them text me pictures of their food so I can look at the brands that they're consuming, what they're eating. Is there too much sugar? The medications that they're on. It's really important to do that thorough investigation and really break down what each person is taking, whether it's a medication, their water supply, the supplements, the food, everything, even what they're putting in their coffee. Everything matters. Brands matter the most. But when you start looking at like SIBO and any other type of gut dysregulation, you have to do that thorough investigation first, looking at some of the labs to see what is growing, what's not, looking at the bacterial strains, trying different strains of probiotics, I think can be helpful. I even like to utilize some of the GI medical foods that I still utilize today, even though I post up a bowel resection. I utilize a lot of those. There's different ones that work better. That really makes such a difference in your overall health, because you're taking things at like the most elemental form and your body doesn't have to do that digestion. I think that's key. And I will utilize some of the medical foods in those patients that have SIBO to try to like just regulate some of their symptoms. And looking at some of the foods, I can't really say that, people will use like the low FODMAP diets. I tend, sometimes it works for some patients, sometimes it doesn't. I think the sensitivities and looking at their sensitivities is more specific.
Mhm.
And I think
Patient rather than a generalized approach.
yeah, you have to look, because what might work for, you might not be able to have one particular food item, but that doesn't necessarily apply to some patients. So you really do have to kind of do trial and error. Back in the day, like 20, maybe 10, 15 years ago, we used to just do major elimination diets. But now with the food sensitivity testing that we have today, it really kind of allows you to not have to go that route and be that extreme.
Make a
And
more
I think that's
targeted
very
approach per
helpful.
patient, which is exciting, right? That it's more individual.
Yeah, and that's so much better. It's really so much better. But yeah, you
And then
just
what
have
about
to
like
really just
sort of streamline less processed foods, less sugar, which is pro-inflammatory? I mean, I think that, carbs are okay with the right sources, but obviously added sugars and added processed sweeteners, and dyes and allergens, in general can be very inflammatory for the endo patient and for patients with allergies and autoimmune conditions, right? Overall.
I think that, it's funny because everyone asks me, like, what about a vegan diet? What about this? I feel that a lot of endo patients thrive on just basic, simple foods, more paleo. If you were to ask me, like, definitely no soy, and soy is just infiltrated in everything.
Mhm.
But we just thrive best on simple foods, nice fruits, vegetables,
The
lean
parameters
protein.
of the grocery store.
Yeah, the parameters of the grocery
Yeah.
store.
Farmers market if you can. I had college kids this week asking about what they could eat in the dorms because the food is so terrible and they don't know what to do. And even the salad bar is gross and upsetting their stomach. And so we could do a whole another episode about the college kid guide to the
You could.
all or whatever that is. Yeah, what we can do. I was like, you move off campus,
You
get
move
a
on campus.
refrigerator,
Yeah.
and then we'll send you some like support things to have on home, some bone broth packets for your backpack, and like, I was just trying
Yeah.
to think of things they could bring with them that, weren't such the terrible mass produced, food that they're getting.
But and
It's
it is
hard. I think it's really
it's
hard.
quality of food. I think quality of food is really key, and staying away from obvious. I mean, it's a no-brainer, right? Like
Mhm.
staying away from all the fast food joints, even the ones that you think are good, they're still using substandard products. And I do think that that truly matters.
Mhm.
In the end of things, like, yeah, should you be eating organic? Of course, you want to reduce your chemical, your
Look,
chemical toxicity and
yeah.
the additives, that load, exactly, as much as possible, because that's going to just drive the inflammation.
Yeah.
Yeah.
And we had a question about the food sensitivity tests, if they can only be available by a doctor or nutritionist. No, actually, there are food sensitivity testing that you can order
Yeah.
yourself online. And you can do them. There are hair analysis. There are different options for food sensitivity testing. And so
Yep.
there are a couple different companies. We're happy to answer this later, but I know Lisa uses Check My Body Health. I've seen that used by a lot of
Yep.
nutritionists and naturopaths as well. There's
Sure.
FD, but you can go directly on the test website to order them, and it's actually cheaper than when you order it on Amazon. And some of these tests are
Sure.
30 bucks and can give a lot of impact. So that's exciting.
I like that too. I like the testing. I think it's really important to do the thorough testing too, that really looks at the chemicals that are in the food supply, because I really feel sometimes it's not just a gluten sensitivity, it's the additives that are associated with gluten that really aggravate people's symptoms.
They may tolerate gluten in Europe,
Yeah.
sometimes you can get by on gluten in Italy because there's not, unfortunately in the US, we're dealing with hyper processed foods and hyper processed, this has been going on since the 50s, when they started first
Yeah.
making a lot of preservatives in foods. And so unfortunately it's been a big part of American culture for a long time. So you have to work hard on it. So farmers markets and the perimeters of the stores are really the best places if you have access to them. Um,
the local farmers, if you can kind of clue in, and I'll even work with patients to find some of, even if they need meal services, like looking for people that are using the local farmers,
Mhm.
those tend to be really beneficial for
And I
patients.
found our farmers market, you can actually talk with the farmers. So like
Exactly.
I have a guy that's from upstate and he has, he sells meat at the farmers market, but he actually does deliveries during the winter time, and buying fresh meat from him has been frozen immediately and it's not sitting on a shelf. It doesn't have red dye injected into it, and
Yeah.
they'll do deliveries in the winter time. And I promise you, buying from them is actually probably cheaper than buying an organic brand from the store or buying it from Whole Foods or somewhere else.
Right.
And you'd be surprised. There's vegetable farm shares. There's different options where you can collaborate and get directly from the farmers. And then you're supporting them. You're cutting out the middleman and giving more support to them. And that's a great way that we can, help the system. So
And to your point, I just want to make one more like comment about that. You're able to talk to the farmers to find out what they're feeding the animals. And if you can find out if you're, especially with endo, not utilizing soy feeds is critical.
Mhm.
I'll have patients that can't tolerate eggs for the most part, but if they get it from their local farmer, that's not, adding soy to the feed, that makes a huge difference, huge difference. And the reason why I say soy is such a major issue with endo patients, soy and estrogen utilize the same receptors on the cells. So we definitely, endo patients want to reduce any type of soy components in their diet. And like I said, you go out to a restaurant, likely if they're using an oil, I'm sure it's cut with a soybean oil. I'm sure it's cut, and you're going to end up getting exposure. So trying to really figure out where your triggers are really key. And that takes time and developing a good relationship with your patient so that you can identify those through like multiple sessions and really trying to improve their overall quality of nutritional health.
Absolutely. Well, thank you so much. And
Thanks.
Lexi, let's have some words about the pelvic floor.
Well, I think, to tie everything in together, Arleigh just touched on this, Lisa. Endo leading up to diagnosis can take a while. And in that time, your body is in a lot of pain and your muscles respond to that by getting tight and dysfunctional. Your bladder responds to that. Your bowels respond to that. So pelvic PT, what I do with most of my patients is kind of retraining a lot of that, teaching the body to relax a little better, teaching the muscles to coordinate a little better, going over bladder and bowel habits and kind of what we can change, because your body's been in this protective mode for so long, you know, because of the endo, because of the inflammation and things like that. So I see patients, conservatively managing endo. I see them pre-op. I see them post-op. Pre-op, I like to get people kind of ready, teach them about what they can do early on, breathing and walking, and then kind of setting up that their expectations that, maybe they have a constipation, outlet dysfunction, or bladder frequency, and endo surgery necessarily right after the surgery is not going to help that. It's changing habits, changing coordination, diet. There's just so many other factors that need to go into everything, which are really important to work on, even before surgery. And then I see a lot of people post-op too, depending on how soon, 4 weeks, 6 weeks, it depends what we do. And you want to, ease back into movement, but also move, right? So deep breathing, light walks, getting your hips moving, that's really important. And then again, dealing with the bladder and bowel habits that might have built up for the last 20 years in your body, that your body has now learned to kind of live this way, and we need to break some of those patterns. And I think, Arleigh, you might have touched on this too with learning, like, I like to give patients all these different tools and patterns and figuring out like what your body responds to and when something happens. So like maybe leading up to your period, that's when your pain is the highest level. And for, a specific patient, that's when they should really up maybe their yoga class, or they should take a magnesium because they know they're going to be constipated that week. So I really look at patterns in people. And so you can figure out like what your exact trigger is, what helps relieve it, because everyone is a little different. Maybe strength training feels great 3 weeks of the month, and then the week before your period, it doesn't. So then maybe you don't strength train that week and you pick it up the week right after and you add, a long walk or something. So that's something that I think pre-surgery, post-surgery, always you want to keep in your mind like your patterns and what your body responds to in terms of PT and movement and habits and stuff.
I think that's a great, helpful piece of advice on that. And I think a lot of times, even with the food picture, I tell patients with the inflammatory things and working on reducing inflammation, if that week before the period is the most symptomatic, as progesterone is rising and ovulation, post-ovulation has occurred, and they're leading up to their most crampy days, that we don't want to also go to a party that day, have gluten, have alcohol, have all this sugar, have this. And if you're going to have one of them, don't do all of them in one day, right? So if you're going to have pizza, have cake, have wine, have all these things on the week before your period, that cycle will be worse. And I see patients, I'm sure you do, around the holidays, after all of the indulgences, then symptoms pick up more, right? And it happens. We have all this stress leading up to the holidays and different times in our life, and then it all happens, right?
Yeah, and the stress response too, I like to point out in people, like your body, your muscles, like we react to that, right? So like maybe you went to a stressful work meeting or a stressful family party, and then your pelvic pain flares after. It's probably related to the stress. And then what can you do to calm down the pelvic pain? Pull out your stretches, pull out your dilators, a wand. You want like a heat pack, tools that, my body tightens in response to stress. This is what I do to counteract that. So yeah, the stress, definitely.
I think like in terms of the whole recognizing where your pain happens, like when you're stressed out, is super important. That's something that I've really been trying to like zero in on and focus on that as somebody who is very anxious and struggles with some mental health issues, especially now being menopausal. I totally have had a change in sort of my mental state from going into menopause, but I really have connected, like when something happens, whether I watch something that's upsetting or there's just things in life, like where that pain goes. And for me, it is right in the areas where I complained before surgery. And then I do notice, like, then I do have trouble with moving my bowels. And then I do have trouble eating because now my stomach feels like it's in knots and nothing's functioning properly because of that.
Mm-hmm.
So I completely can connect to that. And I think that was a huge part of what helped me with pelvic floor was quite honestly, this maybe is embarrassing, but like knowing how my anatomy worked and how it worked properly and how it should be working. Because I don't think my anatomy ever was working properly. Because my symptoms started when I was so young, and just learning about that for me was super empowering. It made me realize, like, if I add fiber to my diet and I try to bulk up my stool, like the next day I'm going to have a better bowel movement. I've also sort of scheduled my morning routine sort of around when I need to go to the bathroom. And I know that sounds crazy, but as somebody who's suffered with constipation and rectal pain like her whole life, like if I have to get up early in the morning to be somewhere, it's gonna mess up my morning, and then I might not feel relieved for the day.
Mhm.
So I just think it's super important that when the patient can connect those things and have those tools, it really can empower them. And the pelvic floor wand was also a drastic game changer for me, where I had these trigger points that there was no way I could get to releasing that pain any way other than that intimate rose wand. And, I'm sure you have patients come in that are a little uncomfortable about doing pelvic floor therapy because maybe they've had a dozen gynecologists up in their business, or, they're feeling insecure, or they just don't want one more person touching them. But for anybody who's maybe afraid, because I feel like there is a little bit of a taboo around pelvic floor therapy, that, people are just like, I can't do another thing. That it can be life changing. And my bladder no longer controls me in terms of where I go throughout my day. I mean, I still frequent the bathroom a lot, but it's not like it was. So just having that one little piece made easier takes down so much angst in your life.
Yeah.
And we have someone asking, Lexi, for pelvic floor, what is it like for patients? For someone that's never been to a pelvic floor visit, what is it like? The frequency that's necessary? How many internal exams do they have to have? What kind of exercises would they do at home or be expected to do? For someone that's never walked in the door with you before, how would you kind of coach them through it? And what would you say?
So it's first an evaluation of everything in your body, right? Like how you move, how you sit, how you squat, how you walk. And then I take a look externally at your abdominal muscles, externally at your hip muscles, external muscles of the pelvic floor. This is totally patient comfort. If you're comfortable with it, I take a look internally. So muscles of the pelvic floor that I assess vaginally. There's 3 layers. So I assess each layer. We're checking for tightness, pain, nerve pain, coordination. Can you squeeze? Can you relax? And then again, if you're comfortable, I take a look rectally at the pelvic floor muscles as well. How you squeeze, how you can push. That has a lot to do with rectal pain, bowel movements, things like that. If someone comes in who has either had a lot of trauma or they're just not comfortable yet with an internal exam, there's plenty of things I can look at externally that tell me a lot about what is going on internally. So I totally try to meet a patient where they are. If they're really uncomfortable with an internal exam. And then we develop a plan based on that, whether, a lot of the patients with endometriosis do have a lot of tightness. So I'll teach them stretches of the pelvis. I'll teach them about a wand. The wand is like this long device that goes in vaginally, and you kind of like push into trigger points and relieve it, push into trigger points. It can be really helpful for pain management. And then ultimately, too, I don't want any patient relying on me, like feeling like I need to see my PT. The only thing that helps is PT. I want them to have the tools to do it. So that's where the wand comes in, that like you learn how to do some of the treatment on your own. And then stretches and deep breathing and things like that. So, sometimes I totally understand pelvic PT can be a little intimidating, but I try to, the patient is in control with what they're comfortable with. If there is something that really will help them internally, then I will explain that. But if they really never want to do internal work, that's totally fine. I get it. So we kind of like see where we are with everything. And I think, Arlie, to your point, a lot of people don't know about their anatomy or how their bladder should work or how their bowels should work. So even sometimes just explaining, oh, your really bad pain day was because you were constipated that day. And they're like, oh, that makes so much sense. Oh, when I'm constipated, I pee every 30 minutes, and realizing, okay, you need to treat the constipation before we can do anything else. Then that can help a lot of people like take control of their symptoms and just like understand their body better. So it's very common. People don't know, a lot of us don't know like the anatomy down there and basic function. So
I think it's like we're not taught it really. And you're lucky if you have a pediatrician that talks to you when you're younger. And some girls don't make it to the gynecologist until they're 18, 19. Like it all depends. But I just think that importance, and like you just hit the nail on the head in terms of like constipation. Like my sciatic nerve, it gets real angry when I'm constipated. Like, and so if you really start to pay attention to those things, like you can see, what causes what. But I think also there aren't enough of you as pelvic floor therapists. Like we don't have enough of you around here. And I know it's building, and we're getting some fantastic people in the area, but I have to say, I also tried like 3 different pelvic floor therapists. Like sometimes certain people, like just like any other practitioner or anybody, like you've got to be comfortable with them and comfortable with yourself. More importantly, and I think that is, if you're uncomfortable with yourself, you're not going to be comfortable with a surgeon or a pelvic floor therapist or a nutritionist. Like you've got to have that self-acceptance and sort of the rest will come. But finding the right people is super important and not always easy either.
And yeah, I think when you're looking for a pelvic floor therapist specifically for endometriosis, there is a website you can look up that like, I can't think of what it's called, where you can look if we are like registered as endometriosis practitioners. And then you can also call and say like, oh, do you treat other patients with endometriosis? Because sometimes you will find in the pelvic floor space that some PTs do more pregnancy postpartum, and they're typically not also treating endometriosis. So that might urge you to go maybe find someone else that does deal a little bit more with endometriosis. So that's a good point to point out that, again, yeah, unfortunately, not all the practitioners know how to treat endometriosis.
Right. I think that's a great point. If you see someone, like what Lexi's saying, if you see someone focused on postpartum or focused on midlife or menopause, bladder dysfunction, stress, urinary incontinence, leaking pee when they cough and sneeze, they're going to be focused on Kegels and strengthening and tightening the pelvic floor rather than what we need to work on in the endo patient. And so it's actually quite dangerous for endo patients to just sort of look online and say, oh, I'm having pain. And then someone says, oh, let's work on your pelvic floor, do 30 Kegels a day. Endo patients are basically in a chronic state of Kegels, is like what I see in my office, right? And I actually have to downregulate the Kegel on their first exam is like, okay, let's just do some deep breathing and be comfortable just to even tolerate an ultrasound and have an exam, And so I think for the endo patient, it's actually the opposite of a Kegel, and they're kind of chronic subconsciously Kegeling all the time because of the pain. And it's a natural response that your body's just trying to do something to handle the pain. And so I think it's really important what you're saying, Lexi, that they should ask how many endo patients they treat and if they're successful with that, or if not, if they know someone else that does do endo,
Well, in the pelvic, like Dr. G, I'm sure you agree with this, but like, I feel like with any other surgery, generally you go to physical therapy after, right? It's like so to me, like if you're going to have excision surgery and you've had endo for years, or you suspect that you do, like it's kind of a deal breaker. Like if you don't do the pelvic floor therapy, I just think you got to learn how to breathe. No one's breathing right. We're all holding all this tension. And then, it's just necessary. I think part of having surgery, like you got to do the PT after. And if anybody out there is like feeling traumatized or like they just can't go do PT, pelvic floor, like I'm happy to share my journey, but I just find it was such a game changer in my life. Like I'm a huge proponent, and I think everyone should do pelvic floor therapy, even if you don't have endo, because it can be life-changing.
Well, and I think what Lexi was saying earlier, she can assess a lot just from you're walking and you're sitting and what things, what things are bothering you and what you can go through, and I don't always see Lexi for pelvic floor therapy. Side note, I see her for a herniated disc. And when I do too many surgeries in 1 week and I lift heavy suitcases and do too much craziness all at once, and then I'm like, Lexi, you gotta help me. But this knowledge between form and function and what we're doing and what kind of stress and like she was talking about earlier about the week before your cycle, it's also like these stressful times in our life and doing all of the things, too many things at once. And it really impacts how you function later. And so it's important to know those triggers and then know how to get out of it. And, Lexi does a lot of great scar work and does massage on C-section scars and abdominal scars and wounds and, works on the lower back and the, hip function and everything without even doing internals. So even from pelvic floor, but also general PT, I think patients aren't always aware that we can write a prescription. Your surgeon can write a prescription for physical therapy or pelvic floor therapy afterwards, and try to get insurance to cover what they can. But even general physical therapy for your back and for your breathing and for thoracic patients that have had lung surgery and then working on their breathing afterwards, these things are crucial, and really important that they recover well and learn the deep breathing again and feel supported and not too much tension after surgery. And that's part of it's helpful after surgery, but it's helpful just in life to learn these little tools and tricks. So
Mhm. Yeah, and then I just saw a question about post-op PT. It depends on, how big the excision surgery was and the extent of the endo and the pain before. Certainly, sometimes people can come in for an eval and I can send them home with this is what you're going to do at home. This is how you're going to ramp up to exercise. Like, I have some people come from really far away and it's not feasible that they can come once a week. So we make a plan and then we check in a month later and that's fine too. I see some people once a week. It really kind of depends on the case. So I feel like, if you're feeling like I can't handle one more thing, I don't want to take on one more appointment, like you can also come in for just one eval and we really individualize your exercise plan and your home stuff as well.
yeah, I think that's great. Just having strategies, even one visit can be, and have some strategies for the future. And so they really know what it is. And, guys, I've been working with Solstice for years now, and it's always important to have with the pelvic floor therapy, a safe space that, you can work on this with. And so we're always happy to collaborate. So we are, going to pull everything together and wrap things up soon, but I want to open the floor for any questions. You guys can post them in the chat box, or if you can also email them. And if we don't get to all of them right now, we'll be happy to respond later on email. And so we can do that. Let me see if there's any more here.
Yeah, do you find the hormone therapy?
How do we prevent endo from coming back post-surgery? So great question. Endo, post-excision surgery. So endo doesn't necessarily always come back. So it's a great question. Endometriosis can come back. It doesn't always come back. Sometimes what we have after surgery or after endo is removed, sometimes fibrosis develops. What Arleigh was speaking on earlier is that sometimes there's scar tissue that could develop where the old endo excisions were done. And so it's not always a recurrence of endo, but there are some patients where endo does recur. So as an endo surgeon that sees many patients throughout their life and many times, sometimes years later for a repeat surgery, I don't always find, if we took out 40 lesions of endo on someone years ago, when we go back for surgery later, I typically will not find 40 lesions of endo again. It doesn't reset. And we think these lesions are there probably from development in utero, from when you were first developing as a baby in mom's tummy, and that these have grown throughout your lifespan. So when you really have them excised down to the root, the risk of recurrence is much lower than if you have an incomplete surgery where they go in and they look and they only remove a few lesions, or they go in and they look and they burn. That's incomplete surgery rather than actually having all of the endo out. So when you actually have all of the endo excised and then you control everything afterwards, the risk of recurrence can be low, but there are patients that are exceptions to this. Genetically, they have a more aggressive type. They've taken a lot of hormone, estrogen for fertility treatments, things like that. There could be side notes where endometriosis can recur. So strategies on that. I mean, all of these tools that we're presenting you today and in many of the upcoming webinars are basically all of the tools in the toolkit that we use every day and every week at the practice. And so we're happy to expose them and show you guys a lot of these resources. Someone is asking thoughts on Botox for pelvic pain. And someone else is asking about prometrium. I'm having an endo excision surgery, and this is the plan afterwards. So, as far as medications after surgery, I'd have to look at the entire sort of plan for the surgery and what's being done, whether it's definitive surgery, whether it's hysterectomy, and then that's the hormone plan afterwards. I do not recommend it's hard to make general statements about an individual case, so I'm not going to do that. This is the session without meeting any of you guys on the panel or the people chatting. I can't really weigh in on input for health advice, but I can say in general, as far as hormone replacement in endometriosis patients, it should be a balanced approach. It should not be unopposed estrogen. So if your doctor is offering you estrogen alone, then I would not recommend that in the endometriosis patient. You should be on balanced hormone replacement in menopause. And what that looks like depends on the patient. And so I'm happy to weigh in and give consults on that if needed later. Botox for pelvic pain. Lexi, do you want to weigh in on this?
Okay, yeah, I think I see, okay, post-excision surgery, post-hysterectomy, Botox for pelvic pain can help if the endometriosis is gone, the inflammation is under control, because Botox is just taking, keeping a muscle a little bit more relaxed. It doesn't work that well pre-endo surgery if the endometriosis is still present, there's still inflammation, and sometimes I do see patients that are getting Botox before they have surgery, and that's not really controlling their pain because the root cause of it is still there. So I think you'll see back and forth, either the Botox worked or the Botox didn't, but it really kind of depends on why they got it and what stage of everything they were in. It definitely can help post-op if they're just kind of this like hypertonic state that they can't relax any other way.
Excellent. And someone's asking about scar tissue. What are your recommendations for scars if they're still hurting years later? And, Lisa does a lot of great work with serapeptide enzymes that can help reduce scar tissue and help you feel better. And so she's always a great support on not just nutrition, but enzymes and things that help in the recovery. And so that's very exciting. Serapeptase, it's seen in a lot of orthopedic surgery for total knee replacements and ortho joint replacements to help reduce scar tissue. And so, it's not been studied in the endometriosis population, but Lisa has a lot of anecdotal data on that.
And I have to say, I think the systemic enzymes and really taking very good brands really help with the post-operative scarring that occurs. And in general, even as you age, you end up getting that fibrosis that kind of covers a lot of your tissues, and it helps, it kind of prevents that dysregulation of regular metabolic function. So if you can utilize the systemic enzymes appropriately, they can be such a benefit with just like the pain. And I used to use it even when I was getting my periods. I would utilize the systemic enzymes just so that I wouldn't be overdosing on any type of pain support while to prevent my period pain that I had. And it's just a lot easier on the system, on the liver. It definitely should be part of your arsenal in your post-operative
Toolkit.
Yeah, in your toolkit. It really should be. It really should be.
Well, thank you so much for everyone for coming. We're going to be cut off in 10 seconds, but it was a fabulous panel, and I'm happy to answer more questions on email. And, always happy to do telehealth. Lisa does telehealth. Lexi, do you do telehealth? Yeah. Sometimes she's more local. But, we're happy to continue to provide resources. And so I do, telehealth. I do telehealth for hormone therapy and can give more opinions about that online. Okay. You guys have a fabulous weekend. Thank you so much for coming.